Which brings us to a big topic of Nigeria's healthcare system, which has moved from where it was in the colonial days to a level that many believe still needs much more improvement. Apart from its achievement in cutting down on polio cases, guinea worm eradication, and relatively improved health indices, our health correspondent Jomi Otaigbe reports that stabilizing industrial relations and upgrading Nigeria's healthcare system to meet international standards are among the next steps that all stakeholders should be taken in the sector.
Aside from the introduction of primary healthcare policy in the 1980s and the Nigerian National Health Insurance Scheme in 2005, Nigeria's healthcare policies seem to have remained static. The National Health Bill, which many believe could help streamline activities in the sector, is yet to be enacted, while universal health coverage in Nigeria is still very low at about 7% coverage of the entire population.
The primary healthcare system, for all practical purposes, is non-functional in most local government areas in the country. And in areas where there are some activities, there is gross underfunding. There are exceptions. Lagos State, Rivers State, Delta State, Federal Capital Territory, few states in the Southwest Zone, and a few states in the North Central zones.
Perhaps owing to efforts of these states, maternal and child mortality rates have decreased between 2008 to 2012, and that's going by the 2012 Millennium Development Goals report. Also, the total number of wild polio cases as at September 2014 stand at 6, against 47 at the same period in 2013.
Life expectancy average between men and women was 47 years. But today, the average is 54. The maternal mortality ratio average was 545 per 100,000. Today, it is 350, still high. But 545 is not the same thing as 350. You take under 5 mortality ratio, the figure was 157 per 1,000. Very high. We are still high, but we have gotten below 100 as average. Today, as I speak, it's 94. Some progress.
But the country still has a long way to go to achieve the Millennium Development Goals, which have to do with reducing child mortality by 2/3, reducing maternal deaths by 3/4, and combating HIV/AIDS, malaria, and other diseases. The incessant strikes in the health sector have not helped matters. Medical doctors and other healthcare professionals in public hospitals have locked horns with themselves and even the government at the expense of the patients, who by force or by choice have to seek alternative medical care in and outside the country.
Government still forms a bulk of the employment in the healthcare sector, and that is why this happens. So if the government begins to think about ways of divesting and improving public PPP relationships, where you are going to get people who will come and run place professionally, one, those people will create services conditions that will be acceptable to a lot of healthcare professionals, but two, they will hold them accountable to.
The Ebola virus disease incident also tested the country's public health emergency capacities. Although 7 people, including the index case, were lost to the disease, 12 people survived the virus following intense supportive treatment.
We at First Consultant Medical Center took a risk. We sacrificed our lives because we knew that we wanted to ensure the safety of Lagosians, Nigerians, and humanity.
We must give kudos to the Federal Ministry of Health and the component elements at state level. I believe that if we continue to handle a whole range of endeavors that way, then of course we might begin to have interesting times.
Healthcare delivery system in many developed and some developing countries now has as focal points safety, effectiveness, patient-centered care, timeliness, efficiency, and equity. For Nigeria's healthcare system to get to that stage, a strong political commitment, adequate funding, and a well-coordinated healthcare team would form the ladder. Yomi Otaigbe reporting for Channels Television News.